we need to change the management of elections, not individuals. It's the systems we need to go for, both at the national and at the local level. Think about that and ask how many times we have to amend the Constitution when it's the Constitution.
The leaders have asked the IEBC not to delay opening the servers from the public to verify the election.
Why is it that every Tom, Dick and Harry can today go register a new political party? Because then you're going to have not only tenderpreneurs, but political party tenderpreneurs, but the people carrying briefcases ready to give out nomination papers to anybody who comes to them for money.
Robert Omer, Switch TV, Nairobi.
Thank you, Robert Omer. Kakamega County government officials in cooperation with police officers closed down all markets in the county according to the new Ministry of Health guidelines for all 13 counties around the Lake region which have suffered a surge of COVID-19 infections. A section of the businessmen have, however, vowed not to close, claiming that they do not have other means of coping with the tough economic times.
Shule tujue ni kubaya, tukae na watoto kwa manyumba, tusikuje sokoni. Hatuwezi toroka watoto wetu tao tunaenda kwa manyumba. Tunaenda kufa na watoto wetu hata kama ni nini. Tia gasi kuja watoto wataka shule ndio tuende wote. La sivyo pikipiki zinaenda. Nani atabeba watoto? Hoteli zinafungwa, watakula wapi lunch? Hao wanakula mshahara, watu wakikaa kwa nyumba mwezi wanakula mshahara. Enough is enough. Pesa za corona zilikuja tu kuiona. Hata hizi mask tunanunua kila siku sio zao. Tulinunua. Mbona wanatusumbua kila wakati?
Nimesikia amri kwamba watu wote wanafurushwa soko na hata sijui sasa kule nyumbani nitakula nini, lakini waja tufuata amri na tutatulia kidogo tafadhali, lakini serikali pia mjue kwamba watoto wanahitaji kula na wanahitaji kusoma.
Mimi ni mfanyabiashara wa manguo. Kusema ukweli tunafunga sababu ya corona. Corona imezidi Kakamega, hata ukisikia vile watu wanakufa, ndio sababu tunafunga mara moja kutokana, yani tunafuata law ya serikali. Afadhali kidogo tupunguze corona ili tupate kuishi.
Elsewhere, the Ministry of Health has partnered with UNICEF and other organizations to come up with a vaccination campaign to vaccinate 22 high-risk counties that have been producing highest numbers of measles infections in the country. The exercise is set to run for 10 days. Chaza Munga with the story.
Measles is a highly infectious disease caused by a virus from which human beings are its only reservoir, and it's the third most common cause of deaths among children from vaccine-preventable diseases. So what exactly is rubella?
Rubella disease is one of the diseases that if a woman is not protected against rubella, they give birth to children who have abnormalities. So these are some of the children who may be born without hands, who may not be born without feet, or children who are actually born blind when they are born, and especially if their mother is not protected against rubella. So measles and rubella are actually vaccine-preventable diseases.
Statistics indicate that there is a steady increase in the number of people infected with measles and rubella viruses in the country. However, women are at a higher risk of rubella disease complications.
The unprecedented increase in the number of unvaccinated children and the accumulation that we've all talked about, Dr. Rose shared with us in the presentation, that we have about 2.1 million susceptible children, and of course the ongoing COVID-19 pandemic has compounded this problem.
A risk assessment done in the country shows that 22 counties including Kilifi, Mandera, Baringo, West Pokot, Kajiado, Kisii, Bomet, Bungoma and Wajir are among the countries with the highest number of measles infections.
It's to reach approximately 3.5 million children of ages 9 to 59 months over this period at an estimated cost of 800 million Kenya shillings. The campaign will involve more than 16,000 healthcare workers who will offer the vaccine at free of charge through 5,061 vaccination posts that will be set up in public places.
Chief Administrative Secretary in the Ministry of Health, Mercy Mwangangi, has urged Kenyans, parents and leaders at large to come out and get their children vaccinated.
appeal to my fellow leaders to mobilize resources to support immunization services at all levels and to encourage their communities to go for vaccination.
The measles and rubella vaccine campaign is set to start on the 26th of June to the 5th of July, targeting 3.5 million children. The official launch shall be this Friday. Sazamunga, Switch TV.
Thank you, Sazamunga. Hospitals are overstretched in the western and Nyanza region as HDU and ICU beds are filling up. In Kisumu County alone, ICU and HDU beds are fully occupied. A crisis that the Council of Governors is calling for strict adherence to existing health protocols to help curb the spread of COVID-19. Harachime files a report.
Hospitals are running out of beds in the intensive care units as COVID-19 Delta variant continues to spread fast across the country in a looming fourth COVID-19 wave. In Kisumu County alone, the ICU and HDU beds are fully occupied. In Homa Bay County, the number of COVID-19 cases has risen by 297 from 645 last week to 942 this week. In Kericho County, the number of people in isolation beds increased from 21 to 66, marking an increase of 45 patients. Counties with the highest number of cases include Nairobi with 115 cases, Siaya 83, Busia 69, Kisumu 66, Mombasa 47, Kiambu 38, Kericho 35 and Homa Bay 20. Council of Governors speaking on the crisis is urging the Ministry of Health to fast-track oxygen support to counties for better response in the pandemic. The council also added that the counties have scaled up their efforts by increasing the bed capacity, including isolation beds, HDU beds and ICU beds. On vaccine rollout exercise, the number of people who have been vaccinated is above the 1.1 million mark, even as Wiper Party leader Kalonzo Musyoka, speaking earlier today, says to reopen the country fully, 15 million need to be vaccinated.
And my urge is if 15 million of us can immediately get the jab, we can open this country.
This comes as the country records 622 positive cases, 313 recoveries and 30 deaths, one of them in the last 24 hours, while 29 are late deaths reported in the months of March, April, May and June. As HDU and ICU beds continue to fill up, especially in the western and Nyanza region, government is being urged to heighten their response and fast-track oxygen support to avert the COVID-19 crisis. Reporting for Switch TV, my name is Harriet Chimea.
Thank you, Harriet Chimea. Still on COVID-19, India has declared a new coronavirus variant to be of concern after nearly 22 cases have been detected across the country so far, which health experts worry could evade antibodies induced by a previous infection or vaccines. Was it first detected in India, where cases of the strain have been reported in at least 3 states. Cases of the Delta Plus variant, which the Indian Health Ministry has described as a variant of concern, as Harriet Chimea now reports.
As of now, cases of the earlier Delta variant, also first detected in India, has been reported in 92 countries and regions. Maria Van, WHO's technical lead for COVID-19, announced this at a news conference in Geneva. According to Portugal's health authorities, cases of the Delta variant now account for over 60% of new confirmed COVID-19 cases in the country's capital, Lisbon. Meanwhile, in Russia, about 90% of the recent confirmed cases in Moscow have been infected with the Delta variant. In Britain, which has seen a resurgence of COVID-19 recently, the Delta variant is also spreading rapidly in some areas. Since June 16th, the number of new confirmed cases in a single day in Britain has hovered above 9,000 for 6 consecutive days, prompting England to delay the lifting of restrictions for 4 weeks until July 19th. Also in the United States, the Delta variant now accounts for about 10% of new confirmed COVID-19 cases there, according to data released by the U.S. Officials at the Center for Disease Control and Prevention Center, CDC, have recently warned that the Delta variant could soon become the dominant strain in the U.S. WHO warned that the Delta variant could spread rapidly if many countries loosen their public health and social isolation measures too soon and their population is not fully vaccinated against COVID-19. Reporting for Switch TV, my name is Harriet Chimea.
Thank you, Harriet Chime. On other stories, the She Leads Kenya has today launched a program that will amplify girls' and young women's voice. According to Rachel Shebesh, girls and young women should strengthen their capacities and take lead in political positions. She also appreciated the government's efforts for empowering girls and young women through various programs.
And the reason I am able to stand and speak about it is because somebody somewhere asked me the question, are you okay? Are you okay?
With our story, we now take a short commercial break. Stay tuned, we'll be back with more.